بسم الله الرحمن الرحيم وبه نستعين. اللهم صل وسلم وبارك على سيدنا محمد وعلى آله وصحبه أجمعين. I am د.انصاف ابراهيم حسين الشمري, lecturer in Department of Pharmacology, College of Medicine, Anbar University, Iraq. My lecture in pharmacology for third stage students. Our lecture today, Aminoglycosides and Macrolides. Aminoglycosides and Macrolides. These antibiotics, the class of these antibiotics is protein synthesis inhibitor. The class of aminoglycoside and macrolides is protein synthesis inhibitors. Aminoglycosides antibiotics involve streptomycin, neomycin, kanamycin, amikacin, gentamicin, tobramycin, and netlimycin. The mechanism of action of aminoglycosides: when susceptible gram-negative organisms allow aminoglycoside to diffuse through porine channels in their outer membranes, these organisms also have an oxygen-dependent system that transports the drug across the cytoplasmic membrane. Then the antibiotic binds to the 30S ribosomal subunits and distorts its function, thus interfering with the initiation of protein synthesis. Thus, all members of this family are inhibiting bacterial protein synthesis. So we can say the aminoglycoside or the mechanism of aminoglycoside through inhibits bacterial protein synthesis. Antibacterial spectrum. The aminoglycosides are effective in the empirical treatment of infections. Why? Due to aerobic gram-negative bacilli, including Pseudomonas aeruginosa. So, aminoglycosides are effective in the empirical treatment. Why? Because, or due to aerobic gram-negative bacilli, including Pseudomonas aeruginosa. This act against aerobic gram-negative bacilli, including Pseudomonas aeruginosa. Resistance to aminoglycoside can be caused by, number one, decreased uptake of a drug when the oxygen-dependent transport system for aminoglycosides or porine channel are absent. So, this is lead to decreased uptake of a drug, result in this bacteria resistant to these drugs. Number two, an altered 30S ribosomal subunit aminoglycoside binding site that has a decreased affinity for the drug. Number three, plasmid-associated synthesis of enzymes such as acetyltransferases, nucleotide transferases, and phosphotransferases enzyme that modified this enzyme lead to inactivate aminoglycoside antibiotics. Also, each of these enzymes has its own aminoglycoside specificity. The pharmacokinetics of aminoglycosides involve administration, distribution, metabolism, and excretion. The administration of aminoglycoside, due to the highly polar structure of the aminoglycoside, lead to prevent adequate absorption after oral administration. So why poor or adequate absorption of this drug after oral administration? Due to this drug has highly polar structure, lead to prevent adequate absorption after oral administration. Therefore, all aminoglycosides except neomycin must be given parenterally to achieve adequate serum level and its current use. And its current use is limited also to topical application for skin infections. The aminoglycoside consider as bactericidal effect, and this the effect depend on concentration and time. So the bactericidal effect of aminoglycoside is concentration and time dependent. Distribution. All the aminoglycosides level achieved in most tissue are low, and concentrations in cerebrospinal fluid are inadequate even when the meninges are inflamed, except for neomycin. So these drugs, the level achieved in most tissue are low, and concentration in cerebrospinal fluid are inadequate even when the meninges are inflamed, except the neomycin. While high concentrations accumulate in the renal cortex and in the endolymph and perilymph of the inner ear. So this is important point for aminoglycoside. These antibiotics with high concentration that are accumulated in the renal cortex and in the endolymph and perilymph of the inner ear. Metabolism and elimination of aminoglycosides. Metabolism of the aminoglycosides does not occur in the host. Also, these drugs are rapidly excreted into the urine, predominantly by glomerular filtration. As well as accumulation occurs of these drugs in patients with renal failure and require dose modification. So when administered these drugs to patients with renal failure, this patient requires dose modification. Adverse effects of aminoglycoside. Number 1, ototoxicity. This side effect can be manifest itself either as auditory damage. This side effect mostly occur with neomycin, kanamycin, and amikacin, or as vestibular damage, occur with the streptomycin and gentamicin. So this side effect can manifest itself either auditory damage or vestibular damage. Ototoxicity is directly related to high peak plasma level and the duration of the treatment. So this toxicity direct related or depend on the high plasma concentration and duration of treatment. Result in deafness may be irreversible and has been known to affect fetuses in utero. Other side effect, nephrotoxicity. Retention of the aminoglycosides by the proximal tubular cells disrupts calcium-mediated transport processes, and this results in kidney damage ranging from mild to severe. Mild is reversible renal impairment, while severe this acute tubular necrosis, which can be irreversible, and this can occur with neomycin, tobramycin, and gentamicin are the most nephrotoxic. Also, other side effect of aminoglycoside, neuromuscular paralysis. This side effect most often occurs after direct intraperitoneal or intrapleural application of large doses of aminoglycoside. So the neuromuscular paralysis can be occur after intraperitoneal or intrapleural application of large doses of these drugs. 4. Allergic reactions such as contact dermatitis. This is a common reaction to topical applied by neomycin, can be cause contact dermatitis as a side effect. Here we are finished aminoglycoside, and we are talking also about macrolides. The macrolides are a group of antibiotics with a macrocyclic lactone structure, to which one or more deoxy sugar are attached. For example of this group of antibiotics is erythromycin. Erythromycin was the first of these drugs to find clinical application. Other member of macrolides is clarithromycin, is a methylated form of erythromycin. This is the chemical structure of clarithromycin. And azithromycin, the chemical structure of it have a larger lactone ring, and telithromycin as a semi-synthetic derivative of erythromycin. So the macrolides involve erythromycin, was the first drug found in a clinical application. Also, clarithromycin is a methylated form of erythromycin. Azithromycin contains large lactone ring, and telithromycin is a semi-synthetic derivative of erythromycin. Mechanism of action: the macrolides bind irreversibly to a site on the 50S subunit of the bacterial ribosome, thus inhibiting the translocation step of protein synthesis. Also, they may interfere at other steps such as transpeptidation. Generally, consider a macrolide as a bacteriostatic and bactericidal. And these drugs considered as bactericidal at high doses. So macrolide considered as a bacteriostatic and bactericidal effect, and especially bactericidal effect at higher doses. Antibacterial spectrum. Erythromycin, it is used in patients who are allergic to the penicillins. And erythromycin is effective against the following: A, gram-positive organism, especially staphylococci, streptococci, pneumococci, and corynebacteria. Also erythromycin act against gram-negative organisms such as Neisseria species, Bordetella, and Legionella are susceptible. Spirochetes, Mycoplasma, pneumonia, chlamydia, pneumonia, and these. So the erythromycin is act against gram-positive organism and gram-negative organism. Clarithromycin, this antibiotic has a spectrum of antibacterial activity similar to that of erythromycin, but it is different from erythromycin by A, it is also effective against Haemophilus influenzae. B, clarithromycin has a higher activity against intracellular pathogens such as chlamydia, legionella, moraxella, and ureaplasma species, and Helicobacter pylori. Azithromycin and erythromycin are virtually identical with respect to antimicrobial activity, except that azithromycin is less active against streptococci and staphylococci than erythromycin. B, for more active against respiratory infections due to H. influenzae and moraxella species and Moraxella catarrhalis. C, the preferred therapy for urethritis caused by Chlamydia trachomatis, caused by Chlamydia trachomatis. Other member of macrolide, telithromycin. This drug has an antibacterial spectrum similar to that of azithromycin. Resistant to macrolides. Resistance to erythromycin is becoming a serious clinical problem, and there are several mechanisms have been identified. Number one, the ability of the organism to take up the antibiotic. Inability of the organism to take up the antibiotic, or the presence of an efflux pump. This lead to decrease entry of a drug inside the microorganism, result in resistance to macrolide. 2. A decreased affinity of the 50S ribosomal subunit for the antibiotic. So the decreased affinity between 50S ribosomal subunits and the antibiotic results in resistance to these drugs. Other mechanism for resistance: the presence of a plasmid-associated erythromycin esterase. Also, both clarithromycin and azithromycin show cross-resistance with erythromycin. This is the important point. Both clarithromycin and azithromycin show cross-resistance with erythromycin. But telithromycin can be effective against macrolide-resistant organism. Pharmacokinetics of macrolide involve administration, distribution, metabolism, and excretion. Administration: the erythromycin base is destroyed by gastric acid. Thus, either enteric-coated tablet or esterified form of erythromycin are administered. So, erythromycin used as base coated erythromycin used as enteric-coated tablet or esterified form. Why? Because erythromycin base is destroyed by gastric acid. Also, clarithromycin, azithromycin, and telithromycin are stable to stomach acid, while these three drugs are stable to stomach acid, while erythromycin destroyed by gastric acid. Food interferes with the absorption of erythromycin and azithromycin, but can increase that of clarithromycin. Distribution: erythromycin distributes well to all body fluid except the cerebrospinal fluid and diffuse into prostatic fluid, uniquely characteristic of accumulating in macrophage also. Similarly, clarithromycin, azithromycin, and telithromycin are widely distributed in the tissues. Azithromycin has the longest half-life, about more than 40 hours, and largest volume of distribution among the 4 drugs. Fate of these drugs, erythromycin, clarithromycin, and telithromycin, are extensively metabolized and are known to inhibit the oxidation of a number of drugs through their interaction with the cytochrome P450 system. Excretion of these drugs, erythromycin and azithromycin, are primarily concentrated and excreted in the active form in the bile, and while the inactive metabolites are excreted into the urine. So, erythromycin and azithromycin excreted by two forms. The active form excreted in the bile, while inactive metabolites are excreted into the urine. Adverse effect: epigastric distress. This side effect is common and can lead to poor patient compliance for erythromycin. Also, clarithromycin and azithromycin seems to be better tolerated by the patients. Cholestatic jaundice as other side effect, especially with the histolate form of erythromycin, as a result of the hypersensitivity reaction to the histolate form. So, the cholestatic jaundice is occurred due to hypersensitivity reaction to the histolate form of erythromycin. Other side effect: ototoxicity. Transient deafness has been associated with erythromycin, especially at high doses. So, ototoxicity occurs as a transient deafness when administered erythromycin with the high dosage. Contraindications of macrolides. Patients with hepatic dysfunction should be treated. Caution with erythromycin, telithromycin, or azithromycin, because this drug accumulates in the liver. Interactions: erythromycin, telithromycin, and clarithromycin inhibit the hepatic metabolism of a number of drugs. This leads to toxic accumulations of these compounds. For example, acetamizole, terfenadine, carbamazepine, valproate, theophylline, warfarin, and cyclosporine. Also, interaction with digoxin, may occur in some patients, and no interactions have been reported for azithromycin. This figure show liver, and when these drugs, atorvastatin, carbamazepine, cyclosporine, theophylline, valproate, warfarin, plus other drugs, when the erythromycin, clarithromycin, telithromycin inhibits cytochrome P450, this leads to inhibits this enzyme, so or the metabolism of these drugs, so the serum concentration for this drug increases, and this leads to toxic effect. Thank you.